Hello everyone, welcome back. Ostomy Innovations, Nicole here, and today's video I am going to talk about women's health and intimacy with incontinence issues. This video is really for women viewers only. As a woman, it's true that our conditions with IBS and chronic gastrointestinal issues are in fact different than men. That's not to say I'm discounting with men the way they feel, and the gastrointestinal, any issue is still very painful. It's just that with women, we experience an array of different issues with pelvic floor pain. And that's exactly what I'm kind of talk about today is pelvic floor pain. So it can affect our bowel and our bladder and can cause pain with intercourse. The problems can stem directly from GI issues or from female productive issues. It can also stem from sexual abuse or rape. And that's why this is extremely difficult information for men to listen to and kind of like be able to understand, because you wouldn't understand if you're a man. You don't have the same organ structure that women have, so you wouldn't know. And the other reason I kind of say is like this is just for women is I guess, if you're taking it from a perspective of loving kindness, then I am all about it. But if you are judging this in any sort of way, or you've already made up your mind that you don't want to hear this, then you should just, simply excuse yourself from this video. Because, as a woman myself, I have lived through some of these experiences, writing and speaking about them. Yes, it's just a health concern, but what people don't understand, it's more than that. It brings up a lot of emotional wounds especially for me, and not because of, just because of the pain and the things that I went through and the experience in my everyday life that other people didn't understand that I was going through. And so there was a lot of overlooked pain, or pain that people can't see or understand. And so with that being said, it was just really difficult to just to live and manage that pain and not be able to explain it, especially when you didn't always know, which is why I'm doing this video. Is a lot of women don't know that these things even exist. They don't know that, if you've had GI issues, if you've had children, if you've had sexual abuse, that these things may in fact be bothering you. But it's pelvic floor therapy. Pelvic floor dysfunction is a real thing, and it's a really painful thing. But yeah, so I'll spare you the details on my issues and the things that I went through, but I will talk a little bit about some of the therapies that I've went through and that. So basically, yeah, so pelvic floor dysfunction can be kind of, I think the best way it can be dealt with is through pelvic floor physical therapy. I know myself, I went through many different types of pelvic floor physical therapy. The only ones I can really remember what their names were was biofeedback, and there was a dilator. And I'm not going to get into the details of them. But if you have pelvic floor dysfunction or think that you do, I would recommend speaking to your nurse and having her explain the different physical therapies, or your doctor of the different physical therapies that are available to you. The other thing that I did have done, or a treatment that was given to me, was with an InterStim device. And that InterStim was essentially implanted into my back side area, and it helped control my bladder. It did work until I had to have it taken out because another procedure I had done made that stop working, and I didn't want to go through another surgery. I had already had several that year, and I was quite over surgeries. So anyways, that is another tool that is used for to help fix the incontinence issues that stem from your pelvic floor. The other thing is, these aren't things that I've done, but these are things that I have learned about, had other professionals speak about, is sexual health counseling. So that can be helpful to you when you have experienced pain or sexual abuse. You can request a women's health specialist, clinical specialist. I'm not sure what they do specifically. I just know that this is something that maybe, I'm not sure if it's newer in this generation or this era of time. I know I never heard of it before, but I guess a women's health clinical specialist. So I believe that that's, if the information was passed on to me, that it's probably good information and something that if you are experiencing these things, you should look into. Some other at-home care things that you can help with your pelvic floor is using like good lubrications during intercourse or during other things. You can also use, vaginal moisturizers. Those are some of the, at-home kind of intimacy things you might want to look into. Another thing that works well, and I learned during physical therapy, was the fact that if you have scar tissue built up in your, midsection there, or if you've had a hysterectomy, if you had a C-section or other surgeries, you'll get a lot of that built up scar tissue, and those need like massaging. And I'm not going to get into how to do that either. I'm not a medical professional. It's just something you should look into if you do experience any type of pelvic floor dysfunction or bowel issues, and ask a medical professional about the massaging. All right, so I will have a link to a bunch of other resources that will be on my resources page on my website. So www.ostomyinnovations222.com, and I have a bunch of resources that were given during some of the presentations I attended at the 2023 United Ostomy Association conference. And there is just a ton of information that I'm passing on, because that's why I am doing this video, right? I don't want other people to go through things. I'm not saying go through what I went through. We are all going through things, but if we can help each other by passing on information, then that's helping everybody. That's helping everybody move through this medical journey a little bit better, a little bit easier. The more information we have for each other, the more information we have to pass on to each other, the better everybody feels, and we become better as people because of it, and healthier because of it. So also, with that being said, please, if you have more information and other things that you'd like to add to this particular content, or any other content related to gastrointestinal, Crohn's, IBS, ostomies, any of that, please send it to me at my email, which is ostomyinnovations222@gmail.com. And again, those both will be in the description here below. So you'll have that, and just any information you have, whether it's your own site, whether it's information you found resourceful, or different types of therapy, or anything that you think is important and you want to pass on to somebody so that they can benefit from it, then please pass that on. A lot of people don't know about pelvic floor dysfunction, and that's too bad. I was finally diagnosed with it at the Mayo Clinic, some years ago, and I would have never known either. In fact, the other reason why I want to make sure this is being heard is that I was misdiagnosed with having endometriosis and given a hysterectomy when I was just 32 years old. And as it turns out, I never even had endometriosis. I basically just was having this pelvic floor pain. And so therapies and all these other things could have helped that, because once we start doing all these surgeries in this area, we can get that prolapse, we can get that pushed down, the organs start shifting, and hence the pelvic floor pain, the pain during intercourse. So pass on any information you have. look into these things. If you're having that pain, make sure you talk to your doctor about some of these things. And yeah, just remember to be kind to yourself. You know, if you're experiencing these things, and you know, with intimacy, with chronic conditions and continence issues, you know, be patient, because it will get better. And as long as you seek out the information and the right resource, it might take going through 4 or 5 different episodes of physical therapy and trying different things, and it just might come to that. But once you find what it is and you get better, that's what matters, right? And then most importantly, tell yourself you're beautiful, because you are, right? And we need to start by reminding ourselves every day that we're beautiful, we're worthy of love, we're worthy of health, we're worthy of being able to enjoy everything this world has. And let's just always continue to share our information and be uplifting to other people. So thank you for listening, and I will catch you on the next video. Thank you. And like and subscribe too. Please like and subscribe. Get the algorithms moving.